Hi, I'm Dr. Scott Johnson from Fairfield Medical Center, and I'd like to discuss with you colorectal cancer screening options. This is a discussion that you should have with your physician. Colorectal cancer is the third most common cancer in the United States. It's the second leading cause of cancer death in the United States. Colorectal cancer typically starts from polyps, and we know that it takes about 10 years for a polyp to develop and transform into a cancer. If we're able to get polyps out before they transform into cancer, we can stop colorectal cancer. Screening mechanisms are in place to try to help stop the cancer. There are really two groups of tests that we look at. First, tests that detect cancer, and then a second group that detect polyps and cancer. The first group of tests are known as fecal or stool collection tests. The fecal occult blood test, the fecal immunochemical test, and the DNA fecal testing. These tests are non-invasive, no prep is required, and they can be done in the privacy of your own home. The first test, the fecal occult blood test, typically requires collecting 2 or 3 specimens and placing it on a card. A liquid reagent is then added to that to check for the presence of blood. These tests need to be performed annually, and a dietary restriction is recommended for 2 to 3 days prior to the testing. There are certain foods that can interact and cause a false positive test with the fecal occult blood testing. This includes artichokes, cauliflower, melon, horseradish, and vitamin C rich foods like citrus can also cause false positive tests. Iron supplements and nonsteroidals like Advil or Motrin can also cause false positive tests. There's a second test known as the fecal immunochemical test, and it's more specific in that it can detect human blood in the stool. It allows the stool to be examined for specific blood without having to restrict the diet. The third test is a DNA testing. Here we see the Colorectal test, which is a commercially available test. Stool is collected in a lab where it's checked for certain biomarkers. If this test is negative, then it can be repeated at this time every 3 years. If any of these detection tests are positive, colonoscopy is recommended. The second group of tests look at both cancer detection and prevention. These include X-ray tests like barium enema and virtual colonoscopy, as well as flexible sigmoidoscopy and colonoscopy. These tests are invasive, they require bowel prep, but the advantage is that polyps can be removed with colonoscopy. The first test, flexible sigmoidoscopy, is often performed in a physician's office. No sedation is required. A prep is required at home. A scope is then advanced into the lower portion of the bowel and advanced up into the left portion of the colon. This allows viewing and looking for the presence or absence of polyps. It is often combined with a barium enema test. This X-ray test is performed in hospitals. A liquid is introduced into the bowel and X-rays are taken of the lower colon. This allows X-rays to determine the presence or absence of polyps or possible masses. The third option is CT colonography, also known as virtual colonoscopy. In this case, a CT scan is performed and the colon is reconstructed on the computer to essentially show a virtual colonoscopy. In this picture, an actual polyp and colonoscopy is seen on the right. On the left, that same patient is seen and a reconstruction has been performed with CT scan to show that identical polyp. Colonoscopy is the fourth option to detect polyps in colon cancer. A prep is taken and patients are often given sedation. A video scope is then advanced into the lower bowel and advanced around the entire large intestine. If polyps are seen, they can be removed at that time. If masses are seen, they can be biopsied. If any of these tests reveal polyps or suspicion of cancer, then colonoscopy is both necessary and recommended. I want to thank you for giving me your time to talk about colorectal cancer screening options. And I hope that you'll discuss with your physician which screening test is appropriate for you. Thank you.